My name is Kevin. I'm from the UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shiraldin.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, voice therapist, and today we are live after treatment with Hemant, and we did his earlier pre-treatment live on June 26, 2022, and the link we have already given in the description of this live, so you can also watch that. And in fact I'm going to play that voice sample also. तो नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर। और आज हम लोग ट्रीटमेंट के बाद लाइव हो रहे हैं हेमंत के साथ, और आज डेट है 20 अगस्त 2022, और हमने इनका ट्रीटमेंट से पहले का भी लाइव किया था जून 26, 2022 को, और उसका लिंक हमने इस लाइव के डिस्क्रिप्शन में दे दिया है, तो आप कंपेयर कर सकते हैं। और इनका जो हमने वॉइस थेरेपी किया वो सारा ऑनलाइन वॉइस थेरेपी दिया, और ये इंडिया में नहीं रहते हैं, एक्चुअली ये इंडियन ही है लेकिन ये NRI है, नॉन रेसिडेंट इंडियन। तो इस लाइव में जो हम चर्चा करने वाले हैं, विल बी टॉकिंग अबाउट सर्टेन टॉपिक्स। आई एम गोइंग टू जस्ट एक्सप्लेन। देयर विल बी इंट्रोडक्शन अबाउट माई सेल्फ एंड आवर सेंटर. In this live, you are going to listen the Hemant's voice after online voice therapy, and in fact, I'll be playing that video which live we did on 26 June. So pre-treatment live also you are going to listen, and I'll be talking about kind of services we provide at our center. We'll talk about the speech production mechanism, and we'll talk about the Puberphonia symptom, cause, treatment method, and we'll be also talking, is there any relapse after treatment, and is all high pitch voice is Puberphonia. We are going to talk, and the tips to keep the voice healthy, and how will you know your speech therapist is not a healthcare quacks. We are going to talk on that point also, and why you should take treatment from certified professionals only. So these are the few points we'll be talking. So first, introduction about myself. So my name is Sanjay Kumar. By profession, I'm a speech language pathologist. So popularly people call me as a SLP Sanjay Kumar. SLP means speech language pathologist, and I did my Bachelor of Science honors in speech and hearing from AIIMS Delhi. So my degree name from AIIMS is like Bachelor of Science honors speech and hearing. I did my post-graduation in the field of speech language pathology, and my degree name is Master of Science in Speech Language Pathology, and you can find in detail in the description of this live also. तो हम एक एक करके, और हमारा सेंटर है, our center is located in Bangalore, and our center name is Sanjay Speech Hearing and Rehabilitation Center. And once you explore our website, which we have mentioned in the description of this video, and once you click the reach me, you will find the where is the center located on the Google map and all the details. So now I'll be suggesting Hemant, tell us how do you feel after treatment, and Yeah, so please tell us and where you stay. We are live at our YouTube channel.
Good evening, everyone. My name is Hemant. I'm currently staying in US. So on July 26th, I reached out to Sanjay sir regarding my puberphonia issue. So I was suffering from high pitch issues, and I kind of noticed this when I talked to some strangers. They addressed me or mistook me to as female, and that is when I realized I have some issues. And even my friends sometimes say that I have high pitch issues, and I also had issues with my loudness and my voice sometimes what do you call stutter a lot, and these are all kind of issues I was having before reaching out to Sanjay sir. And I found out through many online pages, many reviews I've heard about him, and that is when I decided to reach out to sir. And so we started our sessions with online. It's an online session, and I've been taking it for quite a while now. But since I'm outside US, I'm taking it whenever I get time. So probably that is why it took some time. But yeah, and after my session, I can say that my voice changed completely to the one before. I grew up a lot of confidence with my sessions. After my treatment, I feel a lot more confident speaking to people, and even my loudness issues have been taken care of. I earlier used to sound very slow, and people just say they can't even hear me sometimes when I'm in a noisy environment. But now it's different. I feel my voice has become much better, and with Sir's treatment, it has completely changed.
Thanks, Hemant, for explaining so nicely and your experience. So I'll be playing your pre-treatment video also in this live. So that we did on 26. So I'm going to play that one.
Sure.
So.
Yeah. So good morning, everyone. My name is Hemant. I'm currently in United States. I'm originally from Telangana, Warangal, Telangana. So I come to US for my studies, and I'm currently working. I'm 26, and
so I was just playing your pre-treatment video. Those who have watched your pre-treatment and the post-treatment, if you are able to, those who are watching this live, if you are able to see any positive change, please like this video, share this video, so that people like Hemant having a similar problem, they can get hope, motivation, and they can reach to a right place. So you told you are from Telangana, but you are staying in US. So can you tell in your mother tongue what exactly problem was, and how do you feel after treatment?
Yeah. So na peru Hemant. Is it fine if I speak in Telugu, sir?
Yeah.
నా పేరు హేమంత్. నేను ఇప్పుడు యుఎస్ లో ఉన్నాను. నాకు హై పిచ్ ప్రాబ్లం ఉండేది. సో నేను మాట్లాడేటప్పుడు లౌడ్నెస్ కానీ స్టటర్ అవ్వడం కానీ ఇలాంటి ప్రాబ్లమ్స్ ఉండేవి. అండ్ నేను బయట వాళ్ళతో మాట్లాడేటప్పుడు జనరల్ గా నన్ను ఫీమేల్ గా తప్పుగా అర్థం చేసుకుంటారు. బట్ నౌ ఇట్స్ కంప్లీట్లీ డిఫరెంట్. నా లౌడ్నెస్ పెరిగింది, అండ్ ఇప్పుడు నేను చాలా కాన్ఫిడెంట్ గా ఉన్నాను. నా వాయిస్ చేంజ్ అయింది కంప్లీట్ గా ఆన్లైన్ సెషన్ తర్వాత.
So just one thing I'll be asking here, what are the reactions when you are calling after treatment to your friends first time?
So after the treatment, now when I call my friends or my family, they are familiar with my treatment. But if I call to some strangers who doesn't know that I'm taking this treatment, when I call them, they don't even think that they're speaking to me. They kind of even if someone calls me and I lift the call, if I'm talking first time after the treatment, they simply ask, "Who are you? Can you give a phone to Hemant?" So they are not recognizing me, but that is a good thing because that reflects the change I went through after my treatment.
Yeah, thank you. So you can mute your mic. Thank you. You can mute your mic, and I'll be going to the next point, and in between I'll be talking to you also. So next thing was the kind of services we provide. To understand the kind of services we provide. Those who are watching this live, please refer our YouTube channel playlist, and you'll find different playlists for different communication disorder, and all the playlists will be having pre and post treatment videos. So that will give you an idea how much time it takes, because when we do the pre-treatment sample, we tell the date, and post-treatment sample also we tell the date. So you'll get an idea how long for which communication disorder duration of treatment may be. Instead of telling, I'll be asking the people to do some exercise. And just for idea, I'm telling what are the playlists you'll be able to find. You'll find the Puberphonia high pitch voice. So Hemant, I can say once if you could have met me during the pubertal time, I could have told it's a Puberphonia. But at this moment, I can say high pitch voice you had, untreated Puberphonia you had. So that's why in the description of this video, I have mentioned Puberphonia query, because you are not at the pubertal age. So those who are watching this live, if you'll go to the Explore Our playlist, you will find the high pitch voice Puberphonia playlist, vocal cord paralysis, stammering, functional aphonia, functional dysphonia, spasmodic dysphonia, phonatory gap, muscle tension dysphonia, like after stroke aphasia happen. So this kind of video you'll be finding for different playlists. I will be having the playlist, and once you explore the playlist, you'll get an idea about the duration of treatment and what kind of change we do at our center. In fact, you'll find the playlist for like hearing issues patient also. Like once we did the hearing evaluation and we fitted the hearing aid, how the patient communication improved. So that also will be able to find, because by profession I'm an audiologist also. I'm an audiologist and speech language pathologist, because my bachelor degree is Bachelor of Science Honors in Speech and Hearing. So because of that, I'm audiologist and speech language pathologist both. But my master degree is in speech language pathology. So I'm more famous as a voice therapist, and my more expertise in speech language pathology. So this is the services we provide, and for that already I have suggested, please explore our YouTube channel's playlist. And about the speech production mechanism, I'll be talking not in more detail, and if you want to know in detail, please refer the description of this video. You'll find pre-treatment live as well. So in that I have spoken in long detail. But in a nutshell, for a speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. For example, if you want to say paw, both the lips will be coming closer together, and when you want to say the, tongue will be coming between the teeth. When you want to say caw, back of the tongue will be elevating. So each and every sound has its own place, own manner of articulation. So if place of articulation, manner of articulation is wrong, there will be pronunciation problem. So once you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sounds generate, we modify that sound into different sound. And in one sentence, there are so many words. In each word, there are so many sounds. Each sound has own place, own manner of articulation. So it's a little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. That can be seen in case of stammering. If place of articulation is wrong, manner of articulation is wrong, there will be pronunciation problem. But in case of Puberphonia, what happened during puberty, there is a hormone called testosterone will start secreting in case of boys. So their vocal cord mass and length will increase and pitch reduces. But some cases, like case of Hemant, during puberty due to the testosterone, mass of the vocal cord, length of the vocal cord got increased. But because of so many years habit, he was not able to switch on to the new voice. So he tried to maintain his childish voice because of long habit. So instead of vibrating whole mass and the whole length of the vocal cord, he started vibrating thin edges of the vocal cord. So the vocal cord was a thick string of a thick string like a structure, but he was using like a thin string of a guitar like a structure to just vibrating thin edges. So after voice therapy, what I did, I stimulated whole mass and the whole length of the vocal cord. So vibrating mass and vibrating length increased. So the vocal cord, which was behaving like a thin string of a guitar-like a structure before my treatment, now after treatment, it is behaving like a thick string of a guitar-like a structure, and the pitch has been reduced. So this is the biophysics behind that. So I spoke about the speech production mechanism and puberphonia and treatment method and the reason. And the symptom is very simple. If you call on the phone and if you are a boy, even you're like after age of 13, 14, and even beyond that, and people are saying ma'am to you, they are getting confused. So it can be a symptom of high-pitched voice, and sometimes it may be the puberphonia also. So this is the way we can find out. And of course, what the method I explained, it was a non-surgical method, and people believe first you should try voice therapy. If it doesn't work, then only you should think about the other surgical procedure. And even after the surgery, you should take the voice therapy. So why not you should try first voice therapy? So my suggestion is, if you're having similar kind of problem, so you should try first voice therapy. And by this, our YouTube channel, we are creating awareness across the globe about the puberphonia and high-pitched voice non-surgical management. And there is some question patient will ask me, is there a relapse after treatment? So for that, a small suggestion is, those who are watching this live, please refer a video which is there in this description of this video, and that is 35 minutes. In that video's description, we have given link of so many patients to whom we have treated 5 years back and 6 years back, and during COVID time, everyone was free. I was free, and we did live also to just to give the answer. Is there any relapse after treatment? The kind of problem Hemant is having. So, and is all high-pitched voice is puberphonia? So no, answer is no. All high-pitched voice are not puberphonia. Sometimes high-pitched voice can be due to the phonatory gap, muscle tension dysphonia, sulcus vocalis, hormonal issue. So proper evaluation by a certified professional is very, very important. And tips to keep voice healthy. To keep your voice healthy, drink plenty of water. That is useful. These tips are going to be helpful to those who are professional voice user, those who are normal people, and those who are having the voice problem. Drink plenty of water. Water is a very, very good lubricant. 10 to 12 glass of drinking water is a very good idea, and that should be in the room temperature. Avoid frequent throat clearing. If you do frequently like so there will be a lot of friction between the vocal cord, and that may damage your voice and the vocal cord. Avoid whispering. Sometimes we will talk like this, my name is Sanjay Kumar, something like that. That creates stress on the vocal cord. You should avoid this whispering. If you are a professional voice user like teacher and the classroom is big, so you can ask your administration to provide the amplification devices. And if you have the GERD, gastroesophageal reflux disorder, take proper treatment, because that acid sometime will accumulate near to the throat, and that may damage the voice and the vocal cord. Your eating, like dinner time and the sleeping time will have at least 2 hours gap, because after dinner, immediately if you are going to sleep, the acid which will form during the digestion of the food will accumulate near to the throat area, and that may damage the voice or vocal cords. So these are the few things. And avoid smoking. Smoking can result into the vocal cord polyp, and then that can result into the voice problem. So if you want to keep your voice healthy, you can follow these tips. And next was, how will you know your speech therapist is not a healthcare quack? So if you explore our any of the videos description, you will find my degree's name and which year I got the degree and all the detail. But those who will be healthcare quack, they will never mention like nowadays, some healthcare quacks are very, very smart. They will write fake degree or something, and fake college also, but they will scare to like put information in which year they got the degree, because their classmates will catch and found it. So which year your speech therapist got the degree, from which college he got, from which university the college was affiliated, this kind of information is very, very important. So the first thing is, what degree? Like in USA, at least you should have master degree to work as a speech language pathologist. But in India, if minimum bachelor degree if you are having, you can work. So if you're not able to find a professional having master degree, it's okay. If you can take treatment from people having the bachelor degree also. And one thing here I will be adding, like puberphonia and high-pitched voice are not very common problem. I had an opportunity to study in AIIMS, All Indian Institute of Medical Science, New Delhi, and the caseload was so much, number of patients were so much, and I was having interest in the voice disorder. So I got very good clinical exposure, and when I did my master in speech language pathology from University of Mysore, I got like a theoretical background, very sound theoretical background. So I'm in the combination of both. And in fact, I had a passion to work on the voice disorder. So that's the reason. Maybe if you are contacted, suppose one speech language pathologist and a speech therapist, and he tried to treat the puberphonia and it was not helpful, that doesn't mean that you are not a good candidate for the voice therapy. The reason that maybe he may not be having expertise in this disorder. So immediately don't reach to the conclusion like voice therapy technique is not working for me and I should go for thyroplasty or some surgical procedure. Maybe to whom you have contacted earlier that speech therapy may be having expertise in suppose delayed speech language, or maybe having expertise in dysphagia, swallowing problem, or neurogenic communication disorder, but not in the voice disorder. Why? Because he was not able to get clinical exposure. Why he was not able to get the clinical exposure? Because this problem is not very common. This is very rare disorder. And I had an opportunity to study in some institution where we had a very good number of cases. And apart from that, I had a passion to work for the voice problem. People have having those voice problems. So this is the reason why we get the better result at our center. And in fact, our clients are across the globe. Of course, you are from USA, NRI, but I'm not talking about the NRI. The people from USA also have taken treatment from us and they came to our clinic. And not only the USA, all the continent of the world people have come to our center, either online or offline. So this is the information, and I wanted to create awareness among people. And how will you know your speech therapist is not a healthcare quack? So we already discussed, and why you should take treatment from certified professional. So when you will take some healthcare quacks or jhola chap के लोग जब आप treatment लेते हैं, they may damage sometimes voice or vocal cord. And I have come across the patient after taking treatment from the healthcare quacks, they develop the vocal cord paralysis and the vocal nodule, phonatory gap, etc. So please take the treatment from a certified professional. When you go to the petrol pump, when you want to put some petrol in your car or bike, we just try to find out which is the best petrol pump. And it is a matter of health, how you can take treatment from a healthcare quacks or jhola chap kind of person. So take decision wisely, and thank you, Hemant, for supporting me and to create awareness across the globe about the available treatment of the puberphonia and high-pitched voice. So any message you want to give to the people, those who are watching this live, please go ahead.
Yeah. Thank you, sir. First of all, I want to appreciate your effort and spreading this awareness through your YouTube channel. In fact, this has helped me to reach to you, and this was something that motivated me to reach to you. And to the people who are having such problems, please don't lose hope. There are many better treatments and many better clinics like Sanjay sir's who can help you with your voice disorders. So that is all I wanted to say, sir. Thank you everyone, and please don't lose hope.
Okay, thank you so much, and I'll be seeing if any questions are there and I can give the answer, because I was just talking, I was not seeing the question. So I want to tell thank you all for joining us and watching us. Thank you. I'm not able to know the language, but somebody has...
Sir, you're talking on mute, sir.
Oh, sorry. So thank you those who have joined. Thank you so much, and thanks for joining and asking the questions. And I think my therapy session patients are calling on the Skype. So we'll stop this live very soon. But I want to say thank you, Pali Daliwal. Thank you, Safai editor. And thank you, Aisna Praveen. And thank you, Sujita Ahari. Thank you all for joining us and watching us. And thank you so much. And some questions are there. I'll try to give answer. I underwent thyroplasty because I was suffering from puberphonia. There is a one in the chat box. There is some comments. So the person has written, because the name is in some different language, I can't read that. I underwent thyroplasty because I was suffering from puberphonia. A month after the operation, voice problem begins, hoarseness, fatigue, and while talking. That's why I tell always, like first you should try the voice therapy, and when you are going for the surgery, risk is always there. So as the first comment is there, and yeah. So now Pali Dhaliwal is saying hello, sir. Hello, Pali, and Safai editor is saying hello. Hello, Safai, and Aisa Praveen is saying hi. Hi, Aisa Praveen. एंड ऐसा प्रोड्यूसिंग ऑनलाइन कैसे करें? सो ऑनलाइन थेरेपी के लिए जो पहला स्टेप है, फर्स्ट स्टेप है, आप हमें कॉल कीजिए, हम आपकी वॉइस को सुनेंगे, जिसको हम लोग बोलते हैं परसेप्चुअल इवोल्यूशन। फिर ज़रूरत पड़ेगी तो कुछ टेस्ट के लिए रिकमेंड करेंगे, और जो कॉमन टेस्ट मैं रिकमेंड करता हूँ मोस्ट ऑफ द केसेस, दैट इज़ कॉल्ड स्ट्रोबोस्कोपी, और हम टेस्ट के रिजल्ट को देखेंगे, समझेंगे, फिर हम कमेंट कर पाएंगे। और कई बार ऐसा भी हो सकता है कि हम सिर्फ परसेप्चुअल इवोल्यूशन के माध्यम से ही आपकी प्रॉब्लम को समझ लें और हम अकॉर्डिंगली हम फीडबैक दे दें। तो और तब फिर हम डिसाइड करते हैं कि हमारा थेरेपी आप पे वर्क करेगा कि नहीं करेगा, ऑनलाइन काम करेगा या ऑफलाइन करेगा, इसके बारे में हम डिटेल जानकारी दे पाते हैं। और नेक्स्ट लिखते हैं बालाजी दे, हाय सर, हाउ ट्रीटमेंट यू आर प्रोवाइडिंग ऑनलाइन ट्रीटमेंट। तो बालाजी आप हमें कॉल कीजिए, बालाजी प्लीज कॉल अस एंड वी डू परसेप्चुअल इवोल्यूशन ऑफ द पेशेंट फर्स्ट टाइम एंड देन विल बी suggesting you in the detail. And just 1 minute, I'll be just messaging one of my patient who is calling, and this live is going more than expected. Okay, just 1 minute. So next question is and सुनीता आहरी सिंह, सर मुझे बात करना है, आई एम आकाश आहरी राजस्थान से। सो सुनीता, प्लीज कॉल अस and our contact number is in the description of this. Contact detail is in the description of this video. Once you go to the description of this video, you'll find our website. On website, click the reach me, you'll find our email ID, contact number, and on the Google map where is clinic situated. So all the detail you will be able to find, and then you can call us. Or next है बालाजी दे लिखते हैं, श्योर सर, इज देयर एनी प्ले स्टोर एप्लीकेशन अवेलेबल टू चेक योर वॉइस इज नॉर्मल और सम प्रॉब्लम समथिंग लाइक। बालाजी प्लीज कॉल अस फॉर डिटेल इंफॉर्मेशन। एंड सुनीता आर्य इज सेइंग कॉल कहाँ से होगा? सुनीता, आप हमारे वीडियो के डिस्क्रिप्शन में जाइए और आपको मिलेगा हमारा वेबसाइट पे क्लिक कीजिए, फिर क्लिक कीजिए रीच मी, वहाँ पे हमारा कॉन्टैक्ट नंबर होगा, उस पर कॉल कीजिए। तो थैंक यू ऑल फॉर ज्वाइनिंग एंड watching, and those who have joined recently, the information is today we are live after treatment with Hemant, and Hemant was having voice problem, a kind of high pitch voice, and he is not in India, he is in US, and we gave online treatment to him, and today after treatment we are live, and his pre-treatment live we did on June 26, 2022, and that link we have already given in the description of this video. So we'll stop this live, and Hemant, we are going to stop this live. Please tell us what exactly problem you had and how do you feel after treatment once again.
Yeah, so I'm Hemant. I was having a high pitch problem. Whenever I called to strangers, they kind of addressed me as ma'am, and that is when I realized I was having all these problems. So that is when I decided to do some research and came across Sanjay sir's clinic, and contacted them, and I went for online therapy because of my work and all things. Since I'm in US, that is the only way I could reach out to Sanjay sir. So that is how we did it, and after my treatment, I feel a lot more confident, and my voice definitely changed for sure. So people, when I talk to people now, they, especially my friends whom I talked a while ago, they kind of feel they're talking to a different person because there's a lot of change in my voice after the therapy. So I'm really thankful to sir for all the help he has done to me. He has been very patient with me, and I really appreciate your treatment, sir. Thank you.
Thank you, Hemant, once again for supporting me to create awareness about this kind of voice problem, and hope your video will be giving motivation to many people. Thank you so much. Thank you all for joining us, and thank you all. Love you all. And we'll stop this live, and